In a well functioning country, we should have known the National Health Fund's financial schedule for 2025 for several months now. Meanwhile, in Poland, the discussion between the Ministry of Health and the Ministry of Finance on the matter is still going on. The lack of a plan means that hospitals are unable to plan their budgets for next year, and this consequently poses a serious threat to patients. Are those in power aware of this? I want to tell Poles that these problems will pass as if by magic.
Naprawdę?
I guess it didn't work because there are 5 days left until the end of the year, and the Polish National Health Fund has neither a plan nor an idea on how to fund hospitals and medical facilities. Why is this so important? Because the National Health Fund is the main and most important payer in Polish healthcare, and the financial plan is a fundamental document that gives medical facility directors information on what money they can count on from the fund's budget.
Dyrektorzy czy osoby zarządzające
It is difficult for directors or managers of health facilities to plan the operation of their hospitals without knowing what the financial outlay will be.
Jakie będą nakłady, ile oni tych pieniędzy dostaną.
Without that, they don't know if they can afford to take patients.
Sytuacja jest bardzo zła.
This situation is very bad and reflects badly on the functioning of our healthcare. And unfortunately, there are more and more patients, especially the elderly. All indications are that we are facing big problems with healthcare. The residents and the Supreme Medical Chamber have announced that the health system will collapse, and everything indicates that this may happen. Lack of money for the National Health Fund could lead to serious problems. For example, reduced access to medical services and hospital debt. At the moment, the National Health Fund covers its expenses mainly from the health contribution, and what the National Health Fund does not cover must be covered by the state budget.
Mamy bardzo mało lekarzy.
We have a very few doctors. We have a volatile situation regarding the health premium, rising costs, and no systemic solutions. It's a crisis and lots of stress for patients who need urgent specialized treatment, especially oncology patients.
Jeżeli chodzi o choroby nowotworowe,
When it comes to cancer, there is no time here. The fact that certain treatments, diagnostics are postponed for the next months, next years, will reflect badly on the health of Poles.
jak ta pewna diagnostyka jest w tej chwili przekładana na kolejny rok.
Izabela Leszczyna, head of the health ministry, is trying to convince finance minister Andrzej Domański to sign off on the National Health Fund's financial plan, so far without success. The financial plan should be approved in July. We are already at the end of December. If this does not happen in the coming days, it will be a precedent in the more than 20-year history of the National Health Fund.
Mamy ewidentny spór między
We have an obvious dispute between the Minister of Finance and the Minister of Health over the amounts to be included in the financial plan itself. Let's remember that this is a financial plan for all large entities. The problem lies in the tens of billions of zloty, because the truth is that tens of billions of zloty are still missing. Minister Domański insists on looking for maximum savings. Is there a way out of this stalemate? We need a radical reform of the healthcare system in Poland and the education of doctors, because it is connected to this. And the magic wand that was supposed to be so effective before Minister Leszczyna took office has long since lost its power. It's not possible with a magic wand to change everything at once, although I would love to. Several facilities have already been closed recently, due to lack of money, for example. In Warsaw on Barska Street, 2 departments, trauma and orthopedic surgery and general surgery. A dramatic situation is also playing out at a hospital in Żywiec. For months, hospitals have also not been paid for so-called excess payments, and the total amount of the National Health Fund's outstanding debts to the facilities is about 15 billion zloty. But in reality, the health ministry itself does not know how much money is actually missing from the National Health Fund. This year, it needs 3 billion zloty to settle accounts with hospitals. We know that we are short of what we need to pay the excess payments for the third quarter this year of 5 billion zloty. At this point, neither the Ministry of Finance nor the Ministry of Health has a prescription for healing our society. Time is irreversibly passing. And it's worth bearing in mind that some patients don't have that much time.